Can you hear me? Can you hear me okay?
Nicole, could you one more time say if you're able to hear me?
I can hear you.
Okay, great. I can hear you as well. I think that was on my end.
Okay.
Great. And I think we're still waiting for a few people to join. Susan, are you able to hear me?
Yeah, I can hear you just fine. I can't see anything though. So do you have anything on the screen?
Not just yet. I'll go ahead and share my screen shortly.
Okay.
Can do that even right now.
I just am on a different device, so I just want to make sure everything's all better than my last
Yeah.
device.
Well, I'll go ahead and start my screen share as well. Okay, so now you should be able to see my screen
Yes.
with the slides. Okay, fantastic. Okay, so I see. I think we're still waiting on a couple of other speakers here. And actually, I'll go ahead and click through. So for those on the line, you can see who we will have available here to present and answer questions this morning. For questions about recording, if you could please ask Ben Ebby, the host. He can help you out with that. Jim, let us know if you can hear us.
I can hear you. Thank you.
Fabulous, and we can hear you too.
Okay.
John, are you able to hear us?
I can. Good morning.
Fabulous. Good morning. Thanks for joining us. And I think we're just waiting to make sure that we have Nisha on the line too. Oh, Nisha, are you able to hear us?
Yes, I am. Can you hear me?
Fabulous. Yep, I can hear you too. Okay, so I think that, so we have all of our sound checks complete. We thank you all for joining us here today for this update. We're going to start with a little presentation from some of our speakers here, and then we'll open it up for Q&A. So I'll ask you to save your questions till the end, but when it comes time to ask a question, you can let me know you have a question you want to ask by using the raise hand feature. And to access that, if you click on the participants icon at the bottom of your screen, and then the little hand icon, that will show me that you have a question that you want to ask. And then I will let you know when you're unmuted so that you can ask our presenters your question. And then we'll just go ahead and do that until the end of time. We have a specific topic here, wastewater, that we're going to discuss today. So if you have questions outside of that topic, I'll ask you to just send that to our media info. It's media_info@state.co.us so that we can follow up with you there. So without further ado, I'd like to introduce our presenters today. So we have John Putnam, who is the Director for Environmental Programs at CDPHE, Nicole Rowan, who is the Clean Water Program Manager at CDPHE, Nisha Alden, who's the Respiratory Disease and COVID-19 Surveillance Program Manager with CDPHE, Dr. Susan DeLong, Associate Professor of Civil and Environmental Engineering at CSU, and Jim McQuarrie, Director of Strategy and Innovation at Metro Wastewater. So to get us started, I'm going to pass it over to John.
Terrific. Thank you very much. And thank you all for joining us this morning. Really wanted to introduce what is a very exciting opportunity and a partnership with a number of great entities, including our state universities and wastewater providers here in the state, to really provide better data to our epidemiological teams at the state health department as well as local health authorities, knowing that one of the biggest challenges with the COVID pandemic is ensuring that we have adequate information and timely information that we can then use to deploy resources and provide additional opportunities to nip things in the bud. So the opportunity that we have with wastewater monitoring is to provide that early warning for outbreaks of the COVID response. There have been a number of researchers around the world in Europe and the United States that have experimented with this technology, and we believe that it's gotten to a point where it can provide early warning in the vicinity of about 4 to 7 days to know if there are major changes in COVID incidents in the community that we can then use to take that information to deploy testing or other sort of resources. Next slide. So the reason why wastewater provides a good opportunity for this early warning technique is that unlike the kind of regular testing that you've seen and we've all grown used to the reporting on over the last number of months, which generally happens after people have symptoms, but knowing that those symptoms may not be seen for days or even a couple of weeks, the virus actually starts shedding through people's fecal matter within a couple of days of someone becoming infected, and often before they become symptomatic. That shedding virus will find its way into the wastewater system, and we have the opportunity to test for that so that we can get an early warning and an early signal of major shifts, whether up or down, and get that extra time so that we have more tools and more capacity to respond. With that, I'd like to actually turn this over to Jim McQuarrie from Metro Wastewater, who can walk through some of the details about how that works and how that works particularly in Metro's system. Jim?
Thanks, John. So this graphic here is a very simple representation of urban built environments that are served with wastewater treatment versus more rural areas which may have a septic system. But in general, all wastewater systems kind of have these components. Wastewater is generated at residences and commercial spaces like our homes, and along with the wastewater that leaves the house is that fecal matter that John was just talking about. And that wastewater is discharged from houses and into a network of collector pipes. These are small pipes that may run underneath the alleys behind houses or in the streets in front of the houses. And along the way, numerous sets of these collector pipes discharge to a large interceptor pipe that accumulates all of this wastewater from the service population for a given wastewater utility. So you can see on the right there is a little dot indicating sample location. So for this program, a sample of this wastewater is collected at the plant inlet before any treatment occurs. So it's what is referred to as raw wastewater, and its contents within that sample are representative of what is going on within that service area at a regional scale. This is important for this program for folks to understand this. So what we refer to this as is large-scale surveillance. So at this point in time, the program is working to establish a large-scale surveillance opportunity where the sampling and the analysis captures broad trends of the region rather than drilling down to a specific neighborhood, campus, or a building. To help kind of illustrate the scale of this surveillance, the Metro Wastewater Reclamation District, which serves much of the Metro Denver area, its Robert W. Height Treatment Facility, which is a part of this program, will be sampling 2 inlets onto the treatment site from 2 interceptors. And each of those interceptors collect wastewater from about 500,000 people. So when we collect a single sample, it is a composite of the health of 500,000 people per one single sample. And like John said earlier, these samples represent everyone served, so the program won't necessarily be attempting to exactly quantify how many people are carrying the infection, but rather seeks to trend the strength of the signal of the viral RNA as an overall indicator of the prevalence of this virus and hopefully its disappearance of the virus within our communities. So wastewater sampling is part of what we do. Part of regular wastewater utility operations is to monitor the inlet loading into a facility. So routine sampling is a well-established part of the normal operation of a wastewater plant. For all the utilities participating in this program is part and parcel of what we do as a utility. The sample routine, we recently started collecting samples 2 times per week, as all the utilities who are participating are doing so. And what we do is we immediately send those samples to Colorado State University for analysis. And we do this quickly to help minimize the time between the sample collection and when the results become available for interpretation. Before I hand it over to the next presenter, I'll just quickly point out that an important part of making the analysis as relevant as possible is to understand the character of wastewater. And wastewater is, the patterns within wastewater are indicative of sometimes very predictable social behaviors, as well as those sometimes of environmental conditions that are much less predictable. So each utility participating in this program is helping the study by supporting it through local understanding of their own systems, which in the end helps to normalize the analyses and the results to account for spatial and time variability that otherwise could obscure the results. And with that, I'll pass it over to Susan DeLong from Colorado State University.
All right, thank you, Jim. So the molecular work, as Jim said, is being conducted at Colorado State University. And getting this testing program off the ground has been a collaboration between Colorado State University, my colleague Rebecca Farrell at Metro State University, as well as a local company, GT Molecular. And the protocol, the method that we're using to detect the virus in wastewater at a very simple level is the same kind of technology that's being used for nose swabs to test for the virus at the clinical level. However, testing viral concentrations in wastewater is a bit more complicated because of the matrix that we're dealing with. So the first step in our lab process involves filtering the samples to remove solids that are present in that wastewater, leaving at least a good fraction of the viral particles in the liquid phase of that sample. So what comes through the filter contains the viral particles. And then we are concentrating those viral particles using an instrument that's called a concentrating pipette. So you can imagine that if we're surveying a population of 500,000 people in some cases, as Jim just mentioned, the viral particles will actually be very dilute in that wastewater sample. And we want to be able to detect that virus, even though there's really a small amount of virus there. So we use a concentrating pipette, which is like a filter that's able to capture these viral particles. And then we can elute or get those viral particles off of that concentrating pipette filter, and we extract the RNA, which is the genetic material of this virus. So SARS coronavirus 2 is an RNA virus. Its genetic material is in the form of RNA rather than DNA, the type of genetic material many of us are familiar with. So we're extracting RNA, and then we are making a DNA version of that RNA and copying it many, many times, and then using an instrument called a digital droplet polymerase chain reaction instrument to quantify the levels of this virus in the wastewater. It's worth saying that we're not quantifying infectious virus. We are quantifying the genetic material of the virus. So we have a better way to detect the total amount of virus that was sort of shed or released into that wastewater, even if it's no longer infective because it's been in the distribution system. We're going to generate all of this data at CSU, and then we're collaborating very closely with CDPHE, and that data will be sent to the CDPHE epidemiologists for use of that data for decision making. And I'm going to now pass on the presentation to Nisha, who will speak to how that data will be used.
Thank you, Susan. Can you hear me?
Yeah.
Great. So as you all know from following this COVID outbreak over time, we are always looking for data or surveillance points to help inform our decision-making around public health. And so we don't use any single data point to make decisions. And wastewater surveillance data would be combined with other indicators to make decisions. So we consider this another tool in our surveillance toolbox, and we're always looking for more data points to help inform this rapidly changing COVID environment. So likely our first step when we get data from the wastewater analysis, we would be able to look at where we are seeing a high incidence or a high level of virus in a community. And we would want to overlay that on a map with our case level data, saying we know we have all these confirmed cases in these places. What does this wastewater surveillance data tell us in addition to that? So is it that there's no cases in a certain area, but we see all this positive wastewater surveillance data indicating that there's more disease out there or more asymptomatic shedding of viral disease than we know about? And so we would use these information to really understand where disease is, how would we need to shift our resources in the event that we don't have testing in an area that looks like it has a high level of viral shedding? Or do we need to, are we seeing indicators of an outbreak in advance? And that along with the data that John provided, that are we seeing this 4 to 7 days in advance of an outbreak? And what can we do then to prevent that outbreak? Or what can we do to rapidly respond to an outbreak as soon as we find out about it? When an outbreak is reported, we're already behind when it's reported because we don't know about it yet, but this would give us a heads up and a little bit of lead time in responding to an outbreak. So this could involve, like I mentioned, shifting resources appropriately, determining if in a certain area we need to increase or decrease social distancing measures. And it also allows us to determine where we might want to put community testing sites in the event that we're seeing a lot of viral shedding in the wastewater, but potentially not identifying cases as tested by the normal molecular methods. Again, we see this as something we would want to add to all the data we already have and use it as one more tool to make sure we're making the best public health decisions based on our data. And with that, I'll pass it on to Nicole Rowan, who's the program manager for clean water at CDPHE.
So as Nisha indicated, what we're really hoping to do is establish some trends with both the clinical data and the wastewater data. And to establish those trends could take several months to develop meaningful information that we can use, again, as another tool in our toolbox to help inform decision making. As we're interpreting the data, we anticipate there could be several different outcomes, and we've tried to illustrate those here on the slide. As the left graphic shows, there could be potentially a clean upward trend where this type of trend, as we are evaluating the data, could indicate a potential future outbreak. We could also potentially see downward trends, as indicated in the middle graphic, that again help inform social distancing measures in the future. But most likely what will happen is the graphic on the right, which is where we won't have a clear trend, and we need to use different techniques to evaluate that data. When we're dealing with environmental data from wastewater plants, there's a lot that goes into that behind how we interpret and present that information. Some of the challenges that we are working through right now with this effort is one, focusing on normalizing wastewater flows, or the different fluctuations that can occur seasonally in wastewater. Jim talked earlier about our wastewater systems in Colorado and how expansive they can be and complicated. In our wastewater systems, the pipes that collect the wastewater and deliver that to the wastewater facility, there can sometimes be small cracks in those pipes. And when there is precipitation events, or during spring when groundwater levels rise, that can enter the wastewater system, which could dilute or decrease the concentration of the virus in the wastewater. And we'll need to develop some methods to account for that. There also could be very low concentrations of the virus that we see in wastewater, and we won't be able to detect it, and we'll need to establish what our detection levels are for this effort, so we can consistently report information. And with any type of environmental data, there is always a margin of error. And as we work through this project, we'll also be figuring out what our level of confidence is in the data for the varying facilities across the Front Range that we're working with in this pilot effort. We want to touch a little bit on the resources that we are dedicating to this effort. We are still in the works of finalizing agreements, but we're working with Colorado State University, Metropolitan State University of Denver, and 16 wastewater utilities that span from Fort Collins to Pueblo along the Front Range. We recently finalized our contract with Colorado State University, who's going to be doing the bulk of our laboratory analysis, and Metropolitan State will be providing additional laboratory support as we move forward. We also have partnered with 16 wastewater utilities, and they are providing in-kind services of actually collecting the samples and making sure those get delivered properly to our university labs as we move on with sampling. And when we look at the number of customers that these wastewater entities serve, it makes up about 60 to 65% of Colorado's population. As we indicated earlier, CDPHE will coordinate the effort and have epidemiologists, such as Nisha's team, analyze the lab results. The state has dedicated $520,000 toward this effort, and when you average that out over the millions of people that this testing will cover, it's cents per person when we're talking about a sampling effort. So that's also very exciting. And with respect to our long-term vision of how we hope to be able to use the data, Nisha touched on that in detail as far as how it can help inform public health decisions. But we do eventually plan to make this data public, especially for public health officials. But again, we don't expect to have usable data for several months as we're establishing trends over time. And again, to establish a trend, we do anticipate it could take several more months of weekly sampling. There are some other states who are doing similar efforts like we are here in Colorado, and that are a little bit farther along than we are. Arizona and Utah are some neighboring states that have developed some great information, and particularly some very good public dashboards that we can use as a model as we evaluate how to make this information and more public in the future. We also hope to be at a point where we can continue to expand this effort and work with more wastewater utilities across Colorado. But the first step really is to work with the partners that we have now to get our lab capacity, protocols, and other infrastructure in place and secure, so we can have a secure platform to launch from in the future. We really hope that by building on what we're doing here, we'll have a way to have this type of analysis done at a more reasonable price, and again, provide a coordinated testing methodology for other utilities in Colorado, as well as hopefully develop additional lab capacity. And with the processes, lab capacity, and data analysis more streamlined, we can think about looking at potentially moving up in the scale that Jim was talking about. Again, we're at a large scale surveillance effort now, but perhaps we could focus on different parts of a city moving forward, or potentially look at a much more refined scale, such as schools, hospitals, or congregate care facilities. And we also really hope that we can build on this collaborative effort and the capacity that we're building to use wastewater as a public health tool in the future. We see opportunity to potentially track other important health use issues, such as drug use or use of medication to treat breathing problems as a result of poor air quality. And I wanted to just turn it over to Jim for a minute, who is very passionate about this use of wastewater as a resource, and let him touch on a few items as well.
Okay. Did you want to talk about this slide, or do you want me to talk a little bit about wastewater as a resource, Nicole?
Yeah, wastewater as a resource. Thank you, and I can cover next steps. Thanks.
Sure. Okay. All right. Yeah. So you know, a lot of the infrastructure I had shown earlier in the slide, it was all installed in the 20th century, and it was really driven by protection of public health and the environment. And we're 20 years into the 21st century, and wastewater as an industry is really moving towards looking at what comes into the treatment plant as a potential resource. So there's a lot of work underway with regard to recovering energy and nutrients out of wastewater. And I think what's being presented here today, and what is being supported by CDPHE on this program, is really starting to recognize that there's information within wastewater that tells us a lot about the health and social needs of our societies and communities that we serve. And the work that Susan presented earlier, the cost and the availability of these techniques and these analytical capabilities has come down to such an extent that things like this are now feasible. So I'll leave it at that right now, Nicole, and let you finish up with the next steps.
Okay, great. Thanks, Jim. And we just wanted to close with next steps. We have started to deliver samples to Colorado State University since our contract has been signed and put in place. Again, we don't think we'll have any real meaningful information, at least for the next several months, as we establish trends, but we're so excited to be able to get started on this effort. And we'll also be finalizing our agreements with partner entities in the coming weeks. And again, just to emphasize what we've all said today, moving forward, our goal is to collect and get a good understanding of the data so we can identify trends and hopefully be able to use this again as another tool in our surveillance toolbox for decision making or protecting public health.
All right, thank you so much. Well, we really hope that that was some helpful information. And so at this point, I'll open it up for questions. And just as a reminder, we have John Putnam from CDPHE, the Director of Environmental Programs, Nicole Rowan, the Clean Water Program Manager, Nisha Alden, the Respiratory Disease COVID Surveillance Program Manager with CDPHE, Dr. Susan DeLong, Associate Professor of Civil and Environmental Engineering at CSU. And then we also have available to answer questions Dr. Rebecca Farrell from Metro State, MSU Denver, who is a professor of biology, Jim McCrary, Director of Strategy and Innovation at Metro Wastewater, and we also have Vanessa Bernal, the bilingual media specialist with CDPHE, available to answer questions in Spanish. So our first question will be, and just a reminder, to raise your hand, click on the participants button at the bottom of your screen, and then the little raise hand icon so I can see that you have a question, and I will just go ahead and take them in order. So our first question is from Meg Wingerter, and if you could say your name and the outlet that you are with, that would be appreciated.
Hi, Meg Wingeter from the Denver Post. Can you hear me okay?
Yes, we can hear you, Meg.
Okay. I wanted to find out a little bit more. So these samples, as they're coming into the plant, each area, each one might include, people. So how do you get from that very broad information to looking at, okay, maybe we need more testing in this part of the city or what have you?
Good question. For sampling questions, who would like to start with that one?
I could. This is Jim McCory. I could take a stab at beginning a response to that question.
Great. How about you start, and then we'll see if anyone else wants to jump in on the other part of that question. Thanks, Jim.
Yeah. So Meg, there's kind of there's a mapping component to this work that's important, and Nicole had on her slide shown a map of Tempe, Arizona, which kind of helps to illustrate exactly how this works. But the calibration of this work begins with understanding the catchment or the sewer shed, and therefore the community that is represented by a given sample collected at the inlet to the treatment plant. So, so the first step is to map out who and where the sample comes from, and that is really calling on information that's already pretty well established amongst water and wastewater utilities in terms of their service area and their community demographics and things like that. And then from there, that sample would go to Susan, who would be able to take it from the analytical perspective as to what the information is within that sample.
And this is Nicole Rowan. I can try and add on a little bit, and maybe Nisha might have some more thoughts as well. But we'll also have the clinical information for that same regional space, through time, and then we can compare the clinical information for that region to the wastewater information.
Hi, this is Nisha Alden. And yes, I think what would be most important is using our geographic information skills that we have to be able to map both where we're seeing confirmed cases or cases with symptoms compared with what we're seeing as provided by the results from CSU and where these specimens were taken from. To be able to overlay that and really get a broader picture of what disease looks like in Colorado.
Great. The next question will be from Cody White.
Hello, this is Cody White and Dan DeRue from Fox 31 News. How are you? Go ahead, Dan.
Hey, can we see images when we ask him questions? Can we see the person answering the questions? Because we are TV and we need to see faces.
I think at this time, we typically just do these audio, but that's something we can look into. Did you have another question also?
Well, I got several questions, but if we need to see someone's face. Otherwise, we can't do a story without seeing someone answering a question.
Okay, what is your question? And then I guess if the
Okay, and we listened to everything so far, and a lot of great information. I've got about a minute and 30 seconds to tell the story. So in layman terms, 3 quick questions. Why are you doing this testing? 2, how much does it cost? And 3, what is the direct or indirect benefit to our viewers?
Good questions. John, do you want to start maybe, and then we can jump on the other
Thank
2
you.
questions?
Thank you.
Sure. Happy to start with the question. And I think the first question is, why are we doing this? The reason we're doing this program is to provide another tool in the toolbox of our epidemiologists that will provide a signal of possible outbreaks 4 to 7 days earlier than we would otherwise get that information. Currently, we're funding this project for about $520,000. If we expand it, obviously that will cost more money, but we believe that it is a small and prudent investment given the fast and quality nature of the data that we have obtained, and the benefit that it provides to your viewers and to the residents of Colorado is the ability to quickly deploy resources to try to catch and address outbreaks quickly, so that we can really prevent the spread of this, which benefits both our health and the state's economy.
Okay, thanks so much for that, John. Did anyone else I know that was like a 3-parter question. Did anyone else want to jump in and add on like the benefits or anything else? Okay.
This is Susan DeLong. I could just jump in and reiterate that one of the key benefits of this program that was highlighted earlier is that it serves as an early warning signal.
Great. Okay, thanks so much. Next question is going to be from Chris Vanderveen.
Hi, Chris Vanderveen with 9 News. Couple quick questions, and sorry, I'm doing multiple things at once, so you may have already answered these questions, but I'll ask them anyways. How many sample locations do you envision using? And I know you're not going to have results publicly for a number of months, but if you find something along the way that is potentially problematic, what's the process? Do you alert the local health department? Let's say you start to see a lot of positive samples in a certain area, high concentration of RNA. What's the process look like for how you alert the local area?
For the process, oh, go ahead. I'm
Go
sorry.
ahead. Oh, go ahead. This is Nicole Rowan. I can go ahead and try. Does that sound all right, Mariah?
Yes, actually, Nicole, I was going to ask if you could take the second part of that question.
Okay, great. So we have 18 sample locations that are being covered right now. So of the 16 utilities, there's 18 sample points that we'll be taking, again, which covers 60 to 65% of the population. We anticipate that moving forward, Colorado State is helping us develop a dashboard that as the sample results are analyzed, that information will automatically be loaded into that dashboard that's available for both our health professionals and local public health as well. So it will simultaneously be distributed to both local public health and us as the information becomes available. And I think that Nisha really talked about how we think this potentially can be used in the future with respect to refocusing resources, or having a few days early warning will help us with, again, redirecting those resources or identifying potential if there's enough testing in a given area.
And then the number of testing locations, Nicole, are you able to touch on that?
Yes, there's 18 locations that are being targeted to be tested.
Great. John Ingold, you're next on the line.
Great, thanks. Yeah, this is John Ingold from the Colorado Sun. I have a couple questions for Jim McQuarrie. First is I'm wondering if you can just go over the timeline again of how long it takes wastewater to go from someone's house to one of your sample testing locations. And then second of all, I'm wondering if you, I think Metro Wastewater previously sent samples to the BioBot group in Massachusetts. And I'm wondering what you learned from that, if you were ever able to see like a rise in viral transmission through those.
Okay. Well, thanks for that questions, John. So the amount of time it takes for for wastewater from a given location to make it to its wastewater treatment utility obviously varies considerably. Metro Wastewater Reclamation District probably has the longest line. So if you think about the location of the Robert W. Height Treatment Facility, it's in North Denver, yet there's wastewater collected from Cherry Creek Reservoir, southeast Aurora, southeast Denver. So in that case, it could take 12 hours for the wastewater to actually make it from a residence to our facilities, or even a little bit longer. Closer in, it's half hour to hours. We have a lot of smaller utilities participating in this program, and in those cases, that residence time is probably also going to be more on the order of just a couple hours. Your second question, I think, was generally with regard to participation of a number of Front Range utilities in the initial BioBot work. And through the work through BioBot as a community, there's a lot of this information is assembled and put together by the Water Research Foundation. There was a number of learning experiences. John Putnam talked about fecal shedding and the consistency of virus content within an infected individual with fecal shedding. That was a foundational finding that came out of the BioBot work. And then in other things that came out of BioBot is based out of Massachusetts. So they were able to work very locally and intimately with their wastewater agencies in the Boston area. And that came out of their work saying that was a pretty important relationship to get down, that you have to have that local intimacy with the wastewater utilities such that you can really accurately interpret and normalize. We use the word normalize a couple times in this presentation, the data such that it's relevant and useful for epidemiologists to examine the trends and recommend decisions based on those trends. We also learned that turnaround time was critical, and that this in-state program alleviated an issue we had in terms of sending samples from Colorado to Boston and then waiting for the results to come back. So one of the attributes of this program is that we have a system in place that helps us to get turnaround in about 3 days from the day the sample is collected. I hope that answers your question.
The next question will be from Blair Miller.
Hey everybody, it's Blair Miller from Denver 7. John kind of took my questions there mostly, but I guess I'll ask a little bit more pointedly. But you know, when we have this wastewater coming in, like you said, from Aurora, Denver, everything to the same spot, are you determining different catch points to be able to sort of filter out precisely where it's coming from? And I know there was also a BioBot pilot out in Gunnison County. I'm wondering if that same sort of results came from the Front Range stuff, and if that is sort of guiding anything that you're planning on doing as you think about expanding this to other parts of the state.
Jim, are you able to build on that, or is there another person to touch on the Gunnison County piece?
Perhaps Nicole knows a bit about the Gunnison. I could probably help to answer that the first question or reinforce what's important for a program such as this is that each analytical result can be paired up as precisely as possible with the catchment area associated with that sample. So luckily for us as an industry, GIS is commonly used these days to really understand and characterize a sewer shed and to understand exactly where the lines of delineation are for a given interceptor that serves a community and that such sewer shed. So this program we have GIS data layers for all of the wastewater utilities that are participating in this study.
And Blair, this is John Putnam. I think part of your question was, can you kind of pinpoint some of the areas where a viral outbreak may be coming from? And I think going back to some of the next steps that Nicole Rowan had laid out, that ability to get subsystems and chase things back is one of the next steps that as we establish this program, we build up the lab capacity, we really show that it can work here. That's one of the next steps and levels that we'd like to take this so we can get more precise and more granular information from this process.
Great. Our next question is going to be from Taylor Summers. Sorry, Taylor, just one second. Let me unmute you.
Hello?
Taylor, you're on the line.
Okay. I was curious because I have heard this system being used in Utah and Arizona, and I was wondering if you guys could maybe elaborate how it's been potentially used effectively in those states. Because as I remember, about a month and a half ago, Governor Polis was saying he was really worried about some of the rising case counts in those states.
Dr. Farrell, do you want to start on this one, and then we can pass it off to another if there's anything to add?
Yeah, and I don't have specific data about those particular states and what they've seen as far as the data they're getting from wastewater-based epidemiology compared with their case rates. I'm guessing that they're going to give us some interesting data because they've got rising case rates. So I'll say one of the things in Colorado that's been sort of interesting is to be doing a pilot study as we did with Metro Wastewater in a time when we really didn't have rising rates. So we actually followed it down and then followed a very slight rise, and that's all we've seen. So I think that we're still in a place where those data are not being published, and we're still in a place where we're very much trying to figure out how to interpret them. So the two things I'd say here, maybe more in general, would be the first is we don't know quite how to normalize. You hear that word here. Normalize means how do we figure out how much virus signal there is relative to the actual amount of human waste that was in the sample. So I think that everyone is still trying to figure that out. And the second thing we have to keep in mind here is that trends are what's going to tell us the story. So a single sample can tell you, do you have a high signal or a low signal, but you don't know what that means in terms of your community until you have enough data points that you can follow that along and see if you have rising or falling signals. And to me, that's the exciting part about sampling twice a week, is we should start to see those trends pretty quickly.
Thank you.
Great. All right. So we're just at about time. So we'll take one more question and then we will close it out. So Luke Runyon, last question.
Hi, Luke Runyon from KUNC. There were some places in Europe that had been doing this wastewater testing where they were able to go back into kind of archived samples to get a sense of how the virus was present in these places earlier than was originally thought of. Is that something that CDPHE would be doing with this program as well, kind of looking back into the record of old samples.
Dr. Farrell, do you want to start maybe with what was happening in Europe, and then Nicole or John, if you could speak to what CDPHE, if CDPHE is doing that?
Yeah, I think the European studies, and there were some done other places as well, were looking, it was a proof of principle, if I understand correctly, kind of question. So the question at that point was, can we find the virus signal in wastewater, and can we see it correlate with what we now know retrospectively from the public health data? In other words, is there a correlation? Is it worth doing these kinds of studies? It's really sort of remarkable thinking back on it that this all started in January. So we're 7 months, a little bit more than maybe 7 months into this science. And what we see already is very clear data over and over from various places that you do, in fact, have a correlation between the public health situation that unfolds and what you can see from wastewater. It's definitely feces. It may also be from urine. So a lot of that's being sorted out right now. And so I think that's kind of what the state of the art is.
Anything to add?
And this is Nicole Rowan. We didn't really have samples from our wastewater facilities in Colorado from that January or February timeframe to be able to do the analysis that was done in Europe. But the March samples from the BioBot effort will hopefully also provide some insight as we are moving forward with establishing trends with the data we're collecting now.
Wonderful. Well, thank you all again. We're just right at time, a little over. So thanks so much for joining us today. We'll be able to share these slides afterwards. We hope this was useful. And our media list is the best place to stay up to date on any upcoming availabilities. So if you need to be added to that, go ahead and email media_info@state.co.us so we can add you to that list.